Okay, welcome everyone to the second webinar in a series of recordings hosted by Gina Curry and me, Dan Wagner. I'm a student at Northwestern University where I am studying for my Master's of Public Health, and these webinars are part of my field experience internship with Healthy Washington Heights. Today we'll focus on a few new topics, including Chicago's first dementia-friendly library and the concept of presenteeism, while staying grounded in the theme of caregiver support and health. So without further ado, I'd like to turn it over to Gina to give her opening remarks and introduce today's key speakers.
Hello, so as he mentioned, I'm Gina Curry, and I am the founder and the executive director of Healthy Washington Heights, which is a nonprofit public health coalition for the community of Washington Heights on the far southwest side of Chicago. We conduct a variety of health promotion activities, including caregiver support through our community health worker program. Washington Heights has the highest number of residents over the age of 70 than any of Chicago's other 77 community areas. As may be expected in an aging community like Washington Heights, there could be some issues around caregiver support and issues like dementia and Alzheimer's. And I would be remiss if I didn't mention the impact of COVID-19 has had on caregivers' physical, emotional, and financial health. And this is why we've embarked on these, what I like to call micro webinars. So our guests today are two of my favorite people, Dr. Darby Morhardt. She is a research professor for cognitive neurology and Alzheimer's disease and prevention medicine and public health practice at Northwestern University. And she is also the academic co-PI of Reach to Faith, and Reach stands for Research Education for African American Caregiver Health. And Darby has many accolades, but my favorite are friend, mentor, and collaborator. Mr. Melvin Thompson. Now, this is my brother from another mother. The executive director of the Endeleo Institute, which was founded in 2011, and whose mission is to empower Washington Heights and surrounding communities by repurposing existing assets and leveraging community engaged research to improve health and education. He is the community co-PI for Reach to Faith, which is what I just mentioned, and also talk about their novel mission for Woodson Library. So without further ado, I'll turn it back over to start the discussion.
Thank you, Gina, and thank you to Melvin and Darby. It's so nice to have you guys both here. I'm excited for our conversation for our listeners. So just to briefly set the stage a little bit, I want to ground us in understanding some of the demographics of Alzheimer's and dementia caregivers. So this is important because this is mostly who our audience is going to be. According to the Alzheimer's Association, about 83% of help that's provided to older adults in the United States comes from either family members, friends, or other unpaid caregivers. And about 1 in 3 of these caregivers are over 65 years old themselves. So, we also know that caregivers for adults with Alzheimer's or dementia indicate substantial emotional, financial, and physical difficulties about twice as often as other caregivers. So it's important that we talk about caregiver self-care and physical well-being. And another topic we're going to talk about a little bit is presenteeism, which is important because many caregivers are also full-time employees. So presenteeism refers to reduced productivity, even though being present at work due to distractions or an illness or an event. So that's something that'll come up a little bit later on. I wanted to ground us in that understanding first. So my first question to Melvin and to Darby is if you guys could give the audience and me and Gina a little more background on your Reach to Faith project.
I will start, and then Melvin, please feel free to jump in.
Sure.
This was the Reach to Faith project actually started, Gina, you and I went to Trinity United Church of Christ. Endeleo Institute had reached out to Northwestern because they wanted to develop caregiving ministries in churches on the far south side of Chicago. And we first met with Etta McGregor Jones to discuss that. She was the person at Endeleo who initiated the project idea. And because we hadn't worked together before, we sought a partnership building grant from Northwestern through the Alliance for Research in Chicagoland Communities, and got a year-long grant that allowed us to get to know one another and to also bring the 5 churches that she had identified to who were interested in developing their caregiving ministries. And those are Trinity United Church of Christ, St. Sabina, Third Baptist, Fernwood, and Beth Eden. And we met together for that first year in our partnership building monthly to discuss caregiving issues that they were encountering within their congregations. And also we also discussed how we might be able to conduct some research around this area as well, since it's a very little understood and understudied area. So we also had a launching and a kickoff where we had caregivers from across the far south side from all of these different churches come to talk about their concerns. And it was a really powerful first meeting, because people did not hold back on how distressing it is to care for someone with dementia, and how glad they were for the opportunity to speak about their concerns. And we continued to meet on a monthly basis. And then Melvin Thompson, Melvin came on as the director of Endeleo and joined our team shortly thereafter. And we have been, and that was 8 years ago, and we've been going on since then.
And one thing I'd like to even point out, I'm sorry, Darby, go ahead.
Go ahead.
I was just going to say one thing I want to just point out is how, like you said, nobody held back, but to show how strong and necessary this convening was, even after that grant that you talked about ran out, we kept meeting. So it just was a very powerful, and it just shows the impact that, that this Reach to Faith had on the Washington Heights community.
Yeah, and I'll just jump in and say that absent our director's involvement, this was completely over my head. I had no contact, I had no education, no information, didn't know anyone who had experienced dementia or Alzheimer's or anything like that, but just watching the journey of our director and, the physical, mental toll that it took on her. I think it might have been a 2-year period that seemed a lot longer. And her vigilance in terms of after her mom actually died, her determination to reach out to the academic and health institutions to learn more about what she had just experienced. And we'll always be forever grateful for her diligence in doing that, because we wouldn't be in the space that we're in now without someone who could have just, closed ranks and kept it quiet and went on with her life, but decided to be vocal about it. And it was something that I just saw. It wasn't in our wheelhouse to deal with dementia, even though one of our focus areas is health. It wasn't in our area, but it just became something, particularly as Gina mentioned, the age of our residents in Washington Heights. We have the highest median age as well in Washington Heights in the entire city of Chicago. So I just thought that maybe this might be impacting more people than we think. And we unfortunately were spot on because the churches, again, it did not hold back in what they were experiencing, and more so that they didn't understand what they were experiencing in church members and people who may be repeating themselves and seeming a bit out of sorts, disoriented, and was this just old age creeping in, or was this something a lot more serious with a name? And we would go on to find out that it was, and that it impacts African Americans at the 2-to-1 ratio. That once I heard that, I was all in. I was all in, and so that's why we're here today.
Yeah, no, that's awesome, and appreciate you guys kind of taking some time to orient us there. I was wondering if you could expand upon maybe a couple of things or one thing that's come out of the Reach to Faith program that maybe you're most proud of or most excited about coming up forward, either one.
Darby, you wanna?
I can go ahead. It was around like 2 to 3 years. We ended up hosting some focus groups with caregivers from the churches, and it was there that solidified our understanding of the need for increased education within the community around dementia. And also, again, as we had identified in that initial meeting, the distress that people were feeling and the lack of connection to resources in the community. And so it was then that it was around that same time, and it was really a confluence of events, that the Carter G. Woodson Library was going under renovation. And I'll let Melvin talk about this, but his vision for the library really connected very strongly with what people were saying in those groups about their need for education and connection and resources.
Yeah, and briefly, what started as a community development project to restore a library, a regional library in our community that had experienced severe deterioration for probably more than a decade. Wouldn't you say, Gina? I mean,
absolutely. My daughter at the time was 11 and a half, and she had never in her lifetime seen it without the scaffolds around it.
Right.
I thought that was just part of the building.
Yeah, the scaffolding, there was scaffolding around the perimeter of the entire building for more than a decade, and it had become part of the fabric of the community. And when I came in as director, I wanted to do something simple, significant, yet salient in the community that the community could gravitate toward. And I thought, the Woodson Library was staring me in the face with this scaffolding, and I knew that there was relationship to the community. And so fast forward, we got the community together, they voiced their opinion to the city, and we wound up having a successful renovation, almost $10 million renovation of that library. And out of that community development project, a health information hub emerged from the improvement, right? So we not only improved the physical space, but the health perspective of folks was something that was needed by giving them a place to congregate and voice those opinions that we heard in smaller rooms, the past several years, to give them a space that not only was just a space, but a welcoming, non-judgmental place that is accepting of people, and where they wouldn't be judged for the things that they're experiencing. So the library really fit that bill perfectly for us. And then you asked about things we're proud of. Out of that came the formation of a Woodson Library Health Advisory Board. So our partnership with Darby went beyond just the two of us, and all of a sudden Rush Medical Center, the Alzheimer's Association, the American Heart Association, our local federally qualified health center right down the street got involved, other faith-based institutions and residents themselves. So we have all of these people at the table bringing their experience, their expertise, their lived experience, and that has turned into pre-COVID monthly programming that the library graciously gave us the opportunity to present. And it covered a range of subjects, from finances, legal, the myriad of things that a caregiver goes through in the course and in the journey of taking care of a loved one. I can go on about my own lived experience, but there's such a wide spectrum of questions because the disease, in so many different forms, you may just be experiencing mild dementia, and so your needs may be different from someone who's at the other end of the spectrum or even in the middle. And so we needed programming to speak to all of those things. And so, but for COVID, we'd still be actively engaged in person. And now we've had to pivot to do these things, but we're very proud of the partnership from an academic, a civic, and a community-based perspective.
Yeah. Would you want to talk about a little bit how that pivot has taken place? Obviously, we're living amongst COVID right now. What are the challenges that you're facing on a daily basis, or some successes that have come out of it?
The most obvious is the social distance, right? When caregiving is so one-on-one and personal and up close, to now say, I have to care for you from over here is more than a notion. And in my own experience, and I should say that, this has landed on my doorstep in terms of impacting my father, who died from a form of dementia and Parkinson's in 2017, to now our mom is experiencing it. We have to know about the caregivers who are coming to give, to occupy space. Are they wearing masks? What are they doing when they're not in the presence of our home? Are they, maintaining social distance and all the things that have, all these things you have running through your head are stressors, because this is your mom, right? This is something that you're entrusting other people to do. And now the social distance and the thought of, your loved one contracting this disease now that there is no vaccine for, only adds another layer to dementia. And so it's more than a notion.
Yeah. And I'd like to just jump in.
Yeah, go ahead.
I was just going to jump in and say, as I mentioned, Healthy Washington Heights has community health workers. And so one of the things that, and you didn't even mention earlier, we weren't even really too focused on dementia and Alzheimer's, but for community health work, you end up doing a lot of different things. And just for caregivers, because our community health workers more are working with the caregivers, the isolation, because as you said, Melvin, like, now people that you normally interact with, or maybe they bring your groceries, or maybe they come in and out. Now you have to protect that vulnerable loved one, that elderly loved one. So now you don't have this, you have to tell your kids and grandkids, well, don't come over, stand at the end of the block, at the end of the sidewalk and wave, or put the groceries on the porch and walk away. Like literally, that's what our community health workers were doing, bringing groceries, sitting them on the porch, and then they would walk back to their car, and then the caregiver would come and get whatever it is, or even it's a prescription. And that isolation for a caregiver who's already struggling a lot of times, that's really, really tough emotionally.
And is it any wonder that there is data that suggests that the caregiver is likely to die in the care of the person that they're caring for? I mean,
Absolutely.
you know, just another, you know, truism that I'm like, what? You know, how do you navigate this new terrain and maintain a distance to protect yourself, actually, to maintain so that you don't contract the virus, and then somehow make it so the person you're caring for doesn't feel isolated. It's
Yeah.
it's quite a
tough
something.
pill to swallow.
Yeah.
I wanted to get Darby involved a little bit in this conversation. I was wondering if you could kind of touch on your role at the Center for Cognitive Neurology and Alzheimer's Disease, and maybe tell us if there's any kind of projects or insight that you've been working on regarding kind of how COVID has been impacting caregivers, or if not, just any insight you might have on the topic.
Sure. I'd just like to maybe just piggyback on what Gina and Melvin were just saying, though, about they were really underscoring the need for us to, especially during this pandemic time, for the library to pivot and offer online programming. And we did successfully offer something just this past week. And caregivers came. We had a keynote speaker. We had, our stakeholder advisory board members there to offer their expertise and knowledge. And also it was a place for caregiving families to connect with each other and to share with each other. So we are not stopping, it's like, especially now, we're not stopping. And that was the first of several, because we don't see this ending anytime soon, that we're going to be doing this online work probably for a while now. So we have definitely dug in and are going to be continuing to offer those resources. But my work, I'm a clinician. I'm a clinical social worker. I've been a social worker for the past 35 years, working with persons living with dementia and their families in various capacities, primarily through an outpatient clinical setting. I work with neurologists and neuropsychologists and psychiatrists. We do diagnostic evaluations. And then my role is, while the doctor is focused on the medical side of things, I focus on the non-medical side of things. And how does a family organize themselves around the illness, and how do they live with it in the best way possible? How do they have a good quality of life in spite of this disease? And so it's really focusing not just on the losses that are certainly there. There's a lot of loss with this illness in many ways, in relationships and roles for the entire family, but there's also a lot of remaining strengths. And so it's a matter of paying attention and tending to the loss that people feel, but also recognizing that there's just a lot of strength within the person that remains, and also within the family system that is essential to continue to tap. And so a lot of the programs and services that I have been really lucky to have been involved in organizing throughout my work at Northwestern has been around focusing on those strengths and offering opportunities for people to tap into their continued abilities to contribute to society as well. So I'll stop there, but that's kind of the work that I do. I do that in addition to the community engagement work that I've been also privileged to work with Melvin on in the community.
I think it's such a positive way to focus, on strengths, right? You're constantly surrounded by, negativity and negative things happening and loss, but to really kind of step back and let's promote those strengths a little bit higher and make those the emphasis of every day, maybe make things a little bit better.
Right, because there's a lot of resilience too in families that can be, but you also can't ignore the sadness and the loss as well. So it's really both and kind of living with both and balancing both.
I want to switch gears a little bit and kind of, we'll wrap up relatively soon. I know we've been on for time flies when we have these conversations, but Melvin, I was hoping we could have you talk a little bit about, you've mentioned your lived experience on a couple of occasions already. I was wondering if you would expand on that a little bit, and particularly your role as being a male caregiver, and what you've experienced to be some challenges, or what you've seen help support you in that role, and just kind of talk about that for us.
Mm-hmm. Certainly, one of the things that we talked about earlier this week on our virtual town hall in terms of male caregivers and what we experienced at Endeleo in this Reach to Faith program was the lack of male caregivers, period. At those meetings, in those focus groups, and just the absence was, pronounced. Darby and I will remember there was one session that we held, and there was one African-American gentleman there with his wife. And I remember him being in that room for, maybe it was a 2-hour session or 90-minute session, and he didn't say a word. He didn't say a word. Maybe the last 10 minutes of the session, though, I intentionally posed a question to him, and he wouldn't stop talking. I mean, he went on and on and on and on. And the irony of it was they were there for the care of his mother, and his wife was doing the lion's share of the talking during the session. But here's, the son, basically reticent that whole entire time. And I just think that showed me that there are a lot of male caregivers suffering in silence and don't know how to reach out, because it's very difficult. This isn't an illness that you can necessarily see and touch, and you can tell that person has dementia. And so it's hard to articulate. They're just doing their duty, right? And so one of our goals moving forward is to be more inclusive and intentionally more inclusive in getting male caregivers to speak up and talk about what their experiences are like, because we know that they're out there. I know, having 2 siblings, male brothers, I'm fortunate because in the care of both my dad and my mom, I have, folks that I can bounce this off of and be, 100% honest about and get the same thing. So I'm fortunate in that area where, there may be somebody that's going through this that doesn't have anybody to call and say, I just spent the last 14 hours, trying to get my dad to do this or that. And so it's a challenge. And again, the disease is so insidious, and you don't understand so much, but for the partnerships that we have, in academics and with health institutions, I understand better. And I understand that self-care is critical for me, because the data proves that. And so that's why we need to communicate that to these male caregivers, or they're not going to be around, for the loved ones, whether they intend to or not.
Mm-hmm. Yeah, I think that's wonderful to note. And I think we can't understate how important it is to promote these resources and the support that's out there. Like you've mentioned, many times already, you're not going through this alone, even though you might feel like you are. I think that support is always a positive effect on anyone's mental health and well-being.
And let me say one more thing, Daniel. Culturally, in the African American community, there's nothing wrong with us, right? There's nothing going on, and particularly mentally, we're not going. That's a stigma with all that we've experienced, in our culture. The last thing we're going to, admit to is that there's something wrong with us from a mental capacity, from a mental aspect. And so there's a lot of denial. There's a lot of, not coming to grips. And then you can find some tug of wars in the family where this part of the family knows there's something going on with Uncle Joe, and this part of the family is like, he was in Vietnam, what do you expect? He's 75, what do you expect? That's the natural part of aging. So the denial and, the acceptance are things that male caregivers probably, to some degree, might be more comfortable just keeping quiet.
And also culturally, just having a space to feel vulnerable, to be vulnerable, and
absolutely
let your raw emotions show is not always the easiest thing to do. And so, a lot of men will just keep it bottled up and they won't say anything. And
sign of weakness.
Yeah.
And so, I'd rather just, go ahead and get this done because she raised me and I'm going to look after her. And, maybe I forgot to eat today, but I've got to continue to do this. And I might be raising a family myself, like I'm doing. And so there's a balance. I mean, there's so many dynamics attached to this, and it's no different for a male caregiver.
Well, thank you guys both so much for being a part of this. I think that we do have to wrap up given the time constraints. So I'm going to hand it over to Gina in a minute here. But once again, to Melvin Thompson and Darby Morhardt, thank you guys for being a part of this and shedding some light on this very important topic. So Gina, for you.
Absolutely. And thank you so much, Dan, for moderating this important discussion. And thank you for even taking this on as your, applied practice experience for your degree requirement, because, and Melvin, even you're the one who gave us the idea. So thank you. This wasn't even on our initial, I don't know if this was even on the initial plan, but it's so timely, it's so important. And as you know, November is Caregiver Awareness Month. And it's just so important. And I just need an excuse to see Darby. Like, thank you, Darby.
Absolutely.
So much. I mean, we're close to like 10 years, all of us knowing each other. And
I know.
Quite at 10 years, but close. And it's just great to be able to see you guys and to, be able to collaborate. And that town hall, Darby, was awesome. So just thank you so much for just,
Thank you.
sharing your experience, Melvin, your personal experience, Darby, your work, and again, Dan, for moderating this important discussion for Healthy Washington Heights. So thank you so much, and until next time, bye-bye.
Thank you so much.
Thanks
Enjoy.